Hello, I'm Dr Crampton, Chief Medical Advisor at Westmead Hospital.
And I'm Dr James Edwards, Chair of the Pre-Vocational Training Council at the Health, Education and Training Institute. We would like to talk about a very important issue, unacceptable behaviour in medicine. Just as it would be unacceptable to pass a patient who's in cardiac arrest without acting, allowing threatening, bullying or intimidating behaviour in the workplace is unacceptable. These types of behaviours can have a negative impact on the careers of doctors and other health staff, even resulting in good doctors leaving the profession.
The risks of unacceptable behaviour in medicine can be minimised when colleagues and other health professionals treat each other with respect, with dignity and acceptance, and when a health service uses policies and strategies to build a positive culture within the medical workforce. We need your help to continue to build a positive work culture for New South Wales Health.
So let's clarify what types of behaviour we are talking about. It is important to identify what is not workplace bullying and harassment. Legitimate, reasonable and soundly based managerial decisions or actions are not workplace bullying. For example, providing constructive feedback on performance or raising performance issues, providing direction on the work that is to be undertaken and how it is to be undertaken, reasonable allocation of work or transfer of work duties, disciplinary action for proven misconduct, disagreement on an approach or decision stated in a reasonable tone.
Unacceptable behaviour is very different. Unacceptable behaviour can be defined in many ways: bullying, harassment, unwanted sexual advances and assault, be it verbal, physical and sexual.
As a training environment, medicine has some unique characteristics and challenges. There may be a deteriorating patient present, highly technical knowledge and actions required, and significant consequences for poor decision making. All this contributes to a tense environment with high expectations from a training supervisor. At times, a training supervisor may become frustrated by an underperforming JMO, but how they respond can seriously affect the learning opportunity for that JMO. Sometimes as a training supervisor, you feel that there is a need to motivate the JMO. If this is done poorly, it may further undermine the confidence of the trainee, but when done well, these situations can enhance the learning opportunities for the JMO.
It is important to note that bullying is not always physically overt. It can occur via phone, email or social media. You should make yourself aware of your local social media policy to guide you in the appropriate use of these mediums.
Good communication can make the workplace a better environment for teaching, learning and working together, while communication delivered poorly can undermine these outcomes. Sometimes it is not what is said, but the manner in which it is said, which makes it unacceptable.
Discrimination can take many forms. The more we challenge this type of behaviour when we see it, the more we contribute to a work environment which is free of discrimination. New South Wales Health is an equal opportunity employer and has strict policies against discrimination of any kind.
Sometimes people think that a flirtatious comment at work is a compliment, but it might not be seen that way by everyone. Making lewd remarks, offering unwelcome invitations of a sexual nature or overt fraternisation could all be seen as sexual harassment.
Medicine can be a very stressful career, but every doctor needs to know how to control their emotions, as these can affect their work or their colleagues. Lashing out physically or verbally is not acceptable. These acts may constitute criminal offences and can become the subject of legal prosecution.
The effects of unacceptable workplace behaviour can be misunderstood or underestimated, but can have a significant impact on people's lives. It can lead to psychological harm, physical harm, financial loss, loss of reputation or even suicide and death.
If you witness unacceptable behaviour at work, experience unacceptable behaviour at work or are concerned your own behaviour is inappropriate, or if you're concerned about a colleague who you believe may be acting inappropriately, then you need to report this behaviour.
New South Wales Health does not tolerate unacceptable behaviour in the workplace, but we need your help. We need you to challenge incidents you have experienced or witnessed and report them to a supervisor.
In some instances, such as a verbal misunderstanding, it may be possible for an issue to be clarified and resolved directly between the victim and the perpetrator. However, instances of bullying, harassment or violence need to be reported. Depending on the nature of the incident, you can report it to the Director or the Deputy Director of Medical Services, the JMO Manager, your Education and Training Coordinator, your Training Supervisor or your Head of Department. Depending on your circumstances, there are a number of services that you can access for advice or support. These services include the JMO Support Officer Program, the Employee Assistance Program, EAP, the Anti-Bullying Advice Line, your local Human Resources Department, the Royal Australasian College of Surgeons Support Program, and Lifeline.
At New South Wales Health, you are part of a valued team. However, we need your help to ensure that we continue to have a positive and safe workplace culture. You can assist in promoting this culture by ensuring your behaviour is consistent with our core values of collaboration, openness, respect and empowerment.
When we collaborate as a team and are open in our communication, we're able to understand each other's perspective and get the job done.
When we respect each other, we empower an environment of learning where we can achieve our common goal of delivering excellent care for our patients.
And isn't that why we all chose a career in medicine in the first place?